look, today, whether it is a BJP spokesperson or AAP spokesperson, an ordinary citizen, we are all in a problem. How do we protect ourselves against this toxic air, Dr. Trehan? We know the after effects, but how do we protect ourselves?
So the advisory is in 3 layers. One is people who already have some lung like asthma or ILD or other forms of pneumonia that they've had recently. They are in grave danger today. They are actually going to get, we are seeing this, that the OPD visits of lung patients has tripled in the last week. And it's going to get even worse because as this escalates and gets prolonged, people will suffer even more and more. And that's kind of tragic for us. And in a way, very disappointing because we know very well that this problem is going to occur. And nobody does anything in between when we know that this is going to happen. When it happens, everybody goes in there, including the media. The media doesn't pay any attention while this whole thing is going to come. It's only when we get into this gas chamber that we start screaming, and that's a very disappointing fact. Now, I think that every year we have said the same thing. One, protect the patients who already have problems with their lungs, respiratory problems, masks, do not go out, and try to stay indoor as much as possible. Then if you can afford an air purifier, you must have it at home. But not everybody is in that position where they can protect themselves. So we need to protect the whole citizenry of
Dr. Trehan, many people say, have some kada, have this haldi doodh, this, that, the other. Is there anything that can protect you?
I don't think so. I think, yes, we do all say vitamin C, garlic, and all these other things, but your lungs are going to get affected no matter what you do. One thing that you should do is to stay hydrated.
Okay.
Do not get yourself dehydrated because that thickens the blood and it also makes more problems for absorption of oxygen and things like that. So one thing is very important, protection of that layer of people. As I said, the first frontline danger is for those people with lung disease. The second is the people who do not have lung disease but are exposed to such extreme. Masking for them also anytime they go out is absolutely necessary.
So masking, vitamin C, hydration. These 3 are important. If you can afford, of course, an air purifier, nothing like it. But that, of course, viewers, is a luxury. Yes.
Now I come to the children, which is even more important.
Yeah.
Because, it's not only the particulate matter which affects the lungs. It is the noxious gases.
That's
like
right.
Dioxide actually is part of the whole spectrum. The children whose neurological system is now
weaker,
actually developing.
Yeah.
They get affected, and therefore life will be affected. So you must protect the children more.
Keep them indoors. Don't risk them. No activities, I presume. I leave it at this, Dr. Trehan. We're going to continue these conversations in the next few days. The situation obviously deteriorates.